Hello everyone. Today we will be presenting on how can robotics help in combating the COVID-19 virus. My name is Novia Silva and I am an accounting major.
And my name is Shanise and I'm a finance major.
For our presentation, we'll be focusing on the motivation for our research. We will also give you an introduction of our research, present a literature review and case studies, and go into further discussion about our topic.
One of our motives is our future perspectives, which are currently at risk due to the ongoing pandemic. We have goals for ourselves and our families, which we are yet to achieve. Such goals have been put on hold, so we have not been productive as we would have been if this virus had not existed. For instance, the virus has put our internship opportunities on hold for the time being. We have supported all harmless measures put in place to mitigate the spread of the pandemic, and we believe robotics in healthcare is one of the most beneficial measures.
The COVID-19 pandemic caused a massive impact on healthcare, social life, and economies on a global scale. This was an opportunity to create robots to fight the spread of the virus and deploy them into the field. These robots were operated autonomously or are teleported by a person. The main purpose of these robots was to promote a healthy and sterile environment for the medical professionals by reducing face-to-face interactions. The two most vulnerable consumer groups that are particularly affected by the virus and who would benefit greatly from this invention are the older adults and children. Persons who are currently undergoing or are expected to undergo surgery in this unfortunate time will be treated as patients who are infected regardless of their status of the severe respiratory syndrome coronavirus. Under the circumstances of COVID-19, the general surgical safety precautions must be adhered to. In essence, this research emphasizes the role of robotics that include telemedicine, decontamination, and logistics.
Okay, so these are some of the robots that are used in healthcare to mitigate the spread of the virus. So we have the mobile robots, which is used for disinfecting public areas such as airports and hospitals. We have the humanoid robots, which assist of hospital staff by delivering medicine to the patients, doctors using legged robots to take care of the patients remotely. We have the drones that patrol areas and enforce lockdowns, assisting many police officers, and the receptionist robots, which are used at a hospital's reception to disseminate information about various units, section of the hospital and guide patients and visitors. And we have the laparoscopic robots, which is used to help surgeons improve the patient's care by using robotic arms to operate through small keyholes incisions in the abdomen. And this is an example of the laparoscopic robot, which promotes social distancing because it does not require much hospital staff to be present during the surgical procedure.
This research addresses the following questions. How social robots can be deployed for advancing the well-being of the vulnerable consumers? How have the implementation of robotics helped to make the work of the medical professionals easier? And will the inventions of robots eventually replace the need for human efforts within the medical field?
So one of the case studies that we found was since the first bunch of cases identified in Wuhan City, China in December 2019, the coronavirus pandemic has rapidly spread across China. Then it was discovered that the persons who were most at risk were the elderly group, children, and persons with underlying illnesses. The Chinese Health Ministry actively pursued the management of COVID-19 to avoid the blowout of the disease and protecting these groups from contracting the virus. In this pursuit, various robotic technologies were used to control and administer this epidemic. So these images show robots in action during the COVID-19 epidemic in China. So the first image shows the disinfection of robots the disinfection robots in a technological company in Qindo, East China's Shandong province, and the second image shows a patrol robot at a hospital in Shenyang in China's northeastern Lining province checking temperatures of people.
Another case study that we found was 195 experiences of social robots were implemented in real settings. In total, there was 66 different social robots that were identified among the 195 experiences analyzed. The robots that were most recurrent in these experiences were 27 Temi, 13 Zorabots, 10 Softbanks, 8 Greetbots, 7 Cruiser, and 7 Starships. The experiences taken in the database were from 35 different countries. Some of these countries in which we identified a major number of experiences were China, who had 56 of the social robots, the United States with 24, Hong Kong with 13, and India with 10. By sector and area, the experiences were implemented in 104 hospitals, 24 nursing homes, 13 transportation, 9 schools and universities, 8 airports, and 8 hotels. They were also placed in places such as parks, restaurants, office buildings, shopping malls, stores, and highway checkpoints.
The robots performed specific functions which were classified in the 3 main roles, which included license, safeguard, and well-being coaches. Also, the capacity of verbally greeting people, which accompanied other functions, was identified in 94 cases. The robots that were able to perform the largest number of functions were Cruiser, Pepper, Temi, Greetbot, Sandbot, and Promobot. Only 10 robots were used for a single function, which was either delivery or disinfection. We noted that there is an increased need for robotics and automations in healthcare and other affiliated areas day by day. We identified that there was a direct relationship with demand of robotics with the benefits of the vulnerable groups. The additional robots that are put in place will therefore help to mitigate the spread of the virus and in turn protect the vulnerable groups from becoming infected. Drones are an invention that are implemented in some countries to spray disinfectants covering a wider area in a shorter period. Drone delivery can be used to deliver lightweight medical supplies such as pills and masks, as well as delivering other packages. This will ensure that persons of the vulnerable group stay inside as much as possible for them to prevent themselves from contracting the virus.
We have recognized that the aim of the implementation of robotics in the healthcare sector during the COVID-19 virus is not to replace the staffs, but instead was produced to assist and protect them from being infected. And these robots also alleviate much of the staff's burden. Robots sort through all medications and pills, providing the required dosage. The robots can dispense the exact prescribed medicine in a short amount of time using barcodes, therefore being more efficient and reducing human errors. The robots can dispense about 12 prescriptions in less than a minute from its invention of 35,000 medications, making it safer to get proper medication during lockdown protocols, as well as reducing contact between people, suppressing the spread of the virus even more. We made the connection that these robots are not only protecting the medical workers, but are also making the work process much more efficient.
The robot-assisted surgery was found to be useful as it reduces the duration of operations for the patients that need complex oncology surgery to create more space for persons who have the virus. RAS will help to reduce the risk of contamination with body fluids, surgical gases of the surgical area, and the number of medical personnel who will be present while doing laparoscopic surgery.
Robotics were found to be helpful to staffs, but it will never be able to replace them because people desire human interaction. Robots have no emotional intelligence, so patients may feel more comfortable interacting with humans, but in times such as these, where human contact should be limited, robots are the best substitutes.
So that was our presentation on how can robotics help in combating the COVID-19 virus. Thank you.
Thank you.